Today, we are addressing an incredibly crucial topic that affects millions worldwide: strokes. It's a subject that demands our attention, not just for those at risk, but for everyone, as understanding and recognizing the signs of a stroke can be life-saving. Stroke awareness is not just about medical knowledge. It's about being equipped to protect ourselves and our loved ones. Let's embark on this informative journey together. A stroke, in medical terms, is a brain attack. It occurs when the blood flow to a part of your brain is cut off, depriving brain cells of oxygen and nutrients, leading to their rapid death. The effects of a stroke can be devastating, impacting speech, movement, and overall quality of life. Each year, strokes are responsible for numerous disabilities and deaths globally, making it a leading cause of serious long-term disability. Understanding what a stroke is and its impact is the first step in combating this silent epidemic. Why does stroke occur? Strokes occur due to problems with blood flow in the brain. They are commonly caused by either a blockage ischemic stroke or bursting of a blood vessel hemorrhagic stroke. Risk factors include high blood pressure, heart disease, diabetes, smoking, obesity, high cholesterol, and physical inactivity. Additionally, factors like age, family history of stroke, race, and gender also play a role. Certain medical conditions like atrial fibrillation and transient ischemic attacks increase stroke risk. Lifestyle choices, such as diet and exercise, significantly impact these risks. Understanding and managing these factors is key to stroke prevention. In addition to the previously mentioned factors, strokes can also occur due to less common causes such as blood disorders, autoimmune diseases, and infections that affect the blood vessels in the brain. Conditions like sickle cell disease, vasculitis, or meningitis can increase stroke risk. Furthermore, certain lifestyle choices and environmental factors like excessive alcohol consumption and exposure to air pollution also contribute to the risk. Understanding the comprehensive range of causes and risk factors is vital for effective stroke prevention and management strategies. 12 silent stroke signs you should never ignore. 12 silent stroke signs you should never ignore is a critical topic for everyone's health and well-being. Strokes are often thought of as sudden and dramatic, but many times, the signs can be subtle and easily overlooked. These silent signs are alarm bells, signaling that something is wrong in the brain. Understanding and recognizing these signs can mean the difference between rapid treatment and long-term harm. Let's delve into each of these signs, so you can be better prepared to recognize and respond to a stroke. Here's a brief summary of each of the 12 silent stroke signs. 1. Sudden numbness or weakness. This asymmetrical weakness or numbness can range from a mild tingling to a complete loss of sensation and strength. It's a critical sign that the brain is experiencing a disruption in blood flow, and immediate medical attention is crucial for diagnosing and treating the underlying cause. 2. Confusion or trouble speaking. This sign involves sudden difficulty in either understanding speech or speaking coherently. Individuals experiencing a stroke may find themselves unable to form words properly, slurring their speech, or having trouble comprehending what others are saying. 3. Trouble seeing. This symptom involves sudden vision problems, which can occur in one or both eyes. Those experiencing a stroke might notice blurred vision, partial or total vision loss, or double vision. 4. Trouble walking. This symptom includes experiencing sudden dizziness, loss of balance, or coordination issues. It can manifest as an unsteady gait, stumbling, or an inability to walk in a straight line. This sign is particularly concerning as it not only indicates a possible stroke, but also increases the risk of falls and injuries. Immediate medical attention is necessary to determine the cause and prevent further complications. 5. Severe headache. A sudden, severe, and unexplained headache is a critical warning sign of a stroke. It may be accompanied by other stroke symptoms, but can also occur in isolation. The abrupt onset of such a headache indicates a possible disturbance in the brain's blood supply, requiring urgent medical evaluation to rule out serious conditions like hemorrhagic stroke. Prompt attention is crucial for effective treatment and reducing the risk of severe complications. 6. Face drooping. This symptom involves one side of the face drooping or becoming numb, which is a classic sign of a stroke. It often happens suddenly and can be easily observed when a person tries to smile or speak, and one side of the face appears uneven or paralyzed. It's a clear and urgent signal to seek immediate medical attention, as it typically indicates a stroke in progress. 7. Arm weakness. One of the hallmark signs of a stroke is sudden weakness or numbness in one arm. This can manifest as a distinct heaviness or a complete inability to move the arm. Often, when a person tries to lift both arms simultaneously, the affected arm may drift downward or be unable to rise. Recognizing and acting upon this symptom promptly is crucial for timely medical intervention. 8. Speech difficulty. This symptom is characterized by slurred speech or difficulty with language, known as dysarthria or aphasia. Individuals experiencing a stroke may have trouble forming words correctly, speak in a garbled or disjointed manner. It's a significant sign of a stroke, warranting immediate medical attention to address potential damage to these critical areas of the brain. 9. Sudden nausea or vomiting. This symptom involves experiencing nausea or vomiting suddenly and without any obvious cause, such as food poisoning or a viral infection. It can be a less recognized sign of a stroke, especially when it occurs in conjunction with other symptoms like headache, dizziness, or changes in vision or speech. Quick medical evaluation is important to rule out a stroke or other serious conditions. 10. Fainting or loss of consciousness. Fainting might occur with little to no warning and can be a sign of a severe underlying condition, particularly if accompanied by other stroke symptoms. This symptom demands immediate medical attention, as it may signify a life-threatening emergency requiring urgent care. 11. Sudden behavioral changes. This sign includes abrupt changes in behavior or personality. These changes can manifest as uncharacteristic agitation, confusion, irritability, or apathy. These sudden changes are particularly concerning when they have no clear cause and are accompanied by other stroke symptoms. Quick assessment by medical professionals is essential, as these behavioral changes can be a warning sign of neurological disruption. 12. Unexplained fatigue. This symptom is characterized by sudden and unexplained tiredness or lethargy. It's not just ordinary fatigue, it's a profound sense of exhaustion that appears abruptly, without any clear reason such as physical exertion or lack of sleep. It's important to pay attention to this symptom, particularly when it's accompanied by other signs of a stroke, and seek immediate medical attention. Each of these symptoms can occur subtly but signifies a potentially serious condition, requiring immediate medical attention. Recognizing these signs can be critical in getting timely help and potentially minimizing long-term effects. The acronym FAST is commonly used to help remember the key signs of stroke. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drift downward? Speech. Ask the person to repeat a simple phrase. Is their speech slurred or strange? Time. If you observe any of these signs, call emergency services immediately. Time is critical in treating a stroke. Remember, a stroke is a medical emergency, and immediate treatment is essential to minimize brain damage and potential complications. Time is of the essence for stroke detection. Time is a critical factor in stroke detection and treatment. The sooner a stroke is identified and treated, the better the chances are for a full recovery and the lower the risk of permanent brain damage or long-term disability. Delayed treatment can lead to more extensive brain damage and a significantly reduced chance of recovery. It's essential to recognize stroke symptoms immediately and seek emergency medical care, as treatments are most effective when administered early. Remember, time lost is brain lost. Every minute counts in stroke treatment. What to do when stroke symptoms occur? When stroke symptoms occur, it's crucial to act quickly. Call emergency services immediately. Don't wait to see if symptoms improve. Quick medical intervention is vital. Note the time, record when the first symptoms appeared. This information is crucial for medical personnel to determine the appropriate treatment. Do not drive to the hospital. Ambulance personnel can begin life-saving care on the way to the hospital. Provide medical information. If possible, provide the medical team with information about the person's medical history, medications, and allergies. Stay calm and comfort the person. Keep them comfortable and calm while waiting for emergency services. Remember, fast action can save a life and reduce the risk of long-term disability. As we conclude this informative journey on stroke awareness, remember that knowledge is power. If this video has enlightened you about the signs and risks of stroke, please show your support by clicking the like button. Stay updated with more health insights by subscribing to our channel and turning on notifications. Your experiences and thoughts are invaluable. Share them in the comments below. Together, we can spread awareness and save lives. Thank you for watching, and take care of your health.